Meantime, COVID-19 is disproportionately affecting communities of color. According to a CDC report last month, 33% of hospitalized coronavirus patients are Black, compared to 18% of people in surrounding areas. This is happening in a time when protests continue against the way African Americans have been treated by law enforcement in this country, and a number of medical professionals are joining them, calling out inequality in healthcare. At a protest in Chapel Hill, North Carolina, one doctor made it clear to everyone, you see her sign, racism is a pandemic too. And she is joining me now. She is Dr. Jasmine Johnson. She's a maternal and fetal medicine fellow for the University of North Carolina. So Dr. Johnson, a pleasure. Welcome.
Thank you for having me.
Site of my alma mater there. You are a doctor on the front lines. You went into the crowd, with the white coat and mask to hold up that sign. Tell me why.
Well, I think that this is personal for me on many levels. First of all, I'm a Black woman, but I'm also the mother of 2 Black children. And when I think about the future for my children, I can't help but speak out. But I'm also a maternal fetal medicine doctor who researches Black maternal health outcomes. And we know that Black women are 3 to 4 times more likely to die from pregnancy-related causes. Black women have the highest rate of preterm birth. And other studies that I've done show that racism has infiltrated everything, even the way that we practice medicine, even when we don't think that racism is impacting it.
Let me just underscore one of the points you just made. So this is according to the CDC, just in terms of inequality in the public health sphere. The CDC says Black women are 3 to 4 times more likely than white women to die from pregnancy or childbirth-related causes. Talk to me about what you are doing, what your colleagues are doing to help achieve equality in the healthcare system.
Well, one thing that our hospital system is doing, just like a lot of hospitals over the country, is we are looking at cases of maternal morbidity or when moms have an adverse outcome and looking at what contributed to that. We are collecting data on race when it comes to maternal outcomes at our hospital so that we can make sure that a woman's race or her primary language didn't impact her care. We also are rolling out things called bundles, or ways that we can standardize care for women so that when implicit bias is at play and people aren't doing what they should be doing, at least things are standard so that the impacts of racism can be mitigated.
So glad, folks are on this. We've been talking so much about inequalities within the justice system, but it is healthcare, it is education, it is on and on and on. I know in the protest in Chapel Hill, about 500 medical professionals showed up, right, in solidarity. Just what kind of conversations are you having with fellow doctors, nurses, and also what kind of conversations are you having with, as you mentioned, your mother, your children?
Well, I think what puts this movement just on another level compared to other times is that everyone is talking about it. And it's not just the Black people talking about how racism hasn't affected their lives, but non-Black families are having these conversations in their household. Like you said, my colleagues and I have had a lot of conversations in the recent weeks on how we can make sure that we are on the right side of history and making sure that we're doing anti-racism work. For me as a mom, my children, for them, a Black female physician is the rule and not the exception. But when my children leave the house, there's a different set of rules. And I think that is what made me go to that protest, because I don't want my children, when they're adults, to have to sit and talk about these things that their mom has had to speak out on.
Mm-hmm. Dr. Jasmine Johnson, thank you so very much. Nice to have you on.
Thank you. Thank you so much.
And when we come back, we will get you back to the chef there in Harlem. His restaurant is Reverence. How he is handling, been, sitting at the center, the epicenter of this COVID pandemic, and also just as a Black chef in Harlem with everything going on. I want to have a conversation with him. Chef Russell Jackson next.